Hi, my name is Charles Inniss. I'm a health and wellness coach, a physical therapist, and a personal trainer. And if I could only say two things to you about improving health and well-being, this is what I'd say. First, since health and wellness are complex, they're better understood through a holistic lens. And secondly, no matter how much we learn in our society about health, there will always be unanswered questions because nature's wisdom is infinite, our environment is constantly changing, and our bodies are ever evolving. Now, the reason why I think these two sentiments are important is because it affects our approach to health and it affects how we approach behavior change for the purpose of improving health. Now, I want to explore this first idea that health is better understood through a holistic lens. Now, many of the times I feel like we develop flawed perspectives about health because we overly rely on reductionist logic or reductionist thinking. And so when we use reductionist thinking, what we do is we try to isolate variables and come to the one universal truth about something. But because health is complex, there is no one universal truth about health. As an example, if you ask these questions, how do I live to be 100? How do I eat to stave off disease? How do I exercise to increase heart health? Or how do I lose weight? None of those questions can be answered with one universal truth that will apply to everyone all of the time. And so I think that it's useful for us to remember that because health is complex, trying to reduce it to one truth or one idea will awfully leave us with a flawed perspective. Okay, so if we agree that it's better to look at health from a holistic perspective, then what holistic perspective might we use? And there's many different models that have been created to try to describe health from a holistic perspective. But the one that resonates with me is the framework known as the 8 dimensions of wellness. And if you've never heard of the 8 dimensions of wellness before, it simply says this. In addition to considering our physical health and wellness, we can also consider our environmental, emotional, intellectual, occupational, financial, social, and spiritual well-being. And as I say those 8 dimensions, you're likely finding connections between each dimensions. Like most people realize that their occupation, the nature of their work environment, the finances they gain from work, their work responsibilities, all have an effect on their physical health, their mental health, and their social well-being. And so again, sometimes we go astray because when it comes to health, we zoom in on physical health and we try to understand physical health through what's happening in the body. And so we look at biometric data, we look at cholesterol and blood pressure and A1C, and we ask patients on a scale of 1 to 10, what's the level of pain you're experiencing? And so we get all this data about biometrics, about what is happening in the body. But if we only try to understand health by what's happening in the body and not taking a step back and looking at what's happening in our life or in our environment, then we will likely not have a full picture. And so again, because health is complex, it's generally better understood through a holistic lens. And personally, I like the 8 dimensions of wellness as a holistic framework to help me to look at health holistically. Now, even when we look at health holistically, there are always going to be unanswered questions. And I think that this is such an interesting part to talk about. And so let's transition and talk about this unanswered questions. I think that sometimes people get so fixated on wanting to know the one right answer that it often keeps them stuck from pursuing positive behavior change because they're just in a analysis paralysis cycle. And so when we are aware that there is no one truth, then that frees us up to explore options and to try something out to see what happens when we go down a certain path. Okay. Now, I'm going to say something about life sciences as a life science professional that many people know, but sometimes people feel a little bit uncomfortable saying, but I'm just going to say it. Life sciences, like physical therapy, nutrition, exercise physiology, psychology, or softer sciences. And I don't say that to demean them, but I say it to make a contrast between what we might consider a more hard science like physics. And so generally speaking, when we look at hard sciences, they're ones that rely almost exclusively on math. And the difference is hard sciences give us rules and laws that are unbreakable and unmutable, but in life sciences, we tend to get more tendencies. And so I'll give you a few examples to kind of make this distinction. So if we think about physics as a hard science, and we go to the top of the Empire State Building, we take a penny, we drop it off the top of the Empire State Building. It will accelerate at 9.8 meters per second, because that's the law of acceleration due to gravity. And if we drop 1,000,000 pennies off the Empire State Building, they're all pretty much going to accelerate at the same rate, because that's a law that is fixed. It's a rule that's in place, and the rule is never, or if any, rarely broken. But when we look at life sciences, there aren't really rules that are fixed and firm that always hold true in a very predictable pattern. And so let's first talk a little bit about nutrition. I'll give you a nutrition example. In medicine, there is something known as the glucose tolerance test, or GTT. It's the assessment that is used for diabetes. And when some ladies are pregnant, they may have a glucose tolerance test to assess for gestational diabetes. And so what the test involves is simple. Someone will drink 75 grams of pure glucose, and then there will be a monitor of how fast the blood sugar rises and how high the blood sugar rises. And then there will also be a monitor to say, how long does it take to return back to the baseline? And so with hard sciences like physics, we have an input, a penny, and we can predict the output. In hard sciences, we have an action that we can predict the reaction. But in softer sciences, in life sciences, we can have an input, but then we can't predict the output. And so if we give someone 75 grams of glucose to drink, we can't really predict what's going to happen. That's why we assess to see what is going on. Now, the tendency is when people ingest glucose that their blood sugar is going to go up. So we know that that's going to happen. We know the blood sugar is going to go up. We just don't know how fast or how far. Now, what's also, you already know this about people. If we took 100 different people and gave them the exact same input, 75 grams of sugar, they would all have a different reaction or a different output. And what's also challenging about life sciences is not only can we have different outputs across the population, but you can have a different output in the same person. And so if someone does a glucose tolerance test and they get a result, they might decide to change their exercise habits. And then if they do the test again, they'll get a different result. Or they might change their nutrition and they'll get a different result. Or if they are in a state of extreme stress and they've been going through a tough time, they'll get a different result. Or if they've had a period of poor sleep, that will lead to a different result. And so this is the challenge in life sciences. We have tendencies and not rules. And the tendencies are useful because they kind of give us an idea about how the body may respond, but we never can really predict with 100% accuracy what is going to happen in a life science when someone does a certain input or takes on a certain action. Now, I want to give you an example about this same concept in psychology and then one in exercise physiology. So psychology. There is evidence, there's been research studies that show that when people formally practice gratitude, there is a strong tendency that improves their mental well-being. But there are some situations in which practicing formal gratitude works against improving mental well-being. So I've heard it said a couple different ways, but sometimes when people are really severely depressed and they start to try to look for things that they're grateful for, if they can't find anything, then they start feeling worse about their situation because they feel like, wow, I can't even find anything to be grateful for. Or if people practice gratitude in an inauthentic way, and what I mean by that is that they pick something and they try to lie to themselves about the thing that they picked to focus on, then they may backfire because they feel like, I'm just lying to myself. I'm not really grateful for this. Why am I lying to myself? And so again, generally speaking, the tendency is that when people develop an attitude of gratitude or they formally practice gratitude, that will positively influence their mental well-being. But there are some situations in which trying to practice gratitude formally can potentially not support mental well-being. Okay, so last example, I want to give you a study from exercise physiology. Now, again, we get tendencies in life sciences, and you would think that when people do cardiovascular exercise, that their VO2 max or their lung capacity would increase. And there was an interesting study, and what it found was that when they looked at this one biometric factor, VO2 max. So VO2 max is the maximum amount of oxygen that someone can take in and use in a minute. And so they took a bunch of people, they measured their VO2 max, and then they had them exercise for about 2 months. And there was a hockey stick distribution in the adaptive quality in each in the individuals. And so there were non-adapters, there were normal adapters, and there were super adapters. And so just add some numbers to just try to make sense of this. So let's say they took 100 people and they measured their VO2 max. The bottom part of the hockey stick are the people who were non-adapters, meaning that they started off at one spot and at the end, they stayed in the same spot. Didn't really increase their VO2 max much. Then as you start to go up the hockey stick, you have normal adapters, which is people who increase their VO2 max when they did cardiovascular exercise. And then at the very top of the hockey stick, there were super adapters, people who had a dramatic change in VO2 max. And so you already know this about people and you know this about yourself. We have different strengths. And while we all have capacities to grow and adapt, we have different varying abilities to adapt in certain areas. And so again, the tendency is that when people do cardiovascular exercise, that their VO2 max will increase. But it can increase in a lot of different ways. It can increase very, very slightly or a negligible way. It can increase in like a, commensurate way, and then it could increase in an outsized or a super adapting way. So I use these examples from these three life sciences: nutrition, psychology, and exercise science, because those are three of the big areas that we use when we're trying to improve our health. And so I just want to make the point. Again, I think life sciences are great. We need to study tendencies because that's how we can give people advice about the best possible path from point A to point B. But the main point is that in life sciences, we get tendencies and not hard and fast rules that are always unbreakable and immutable. So why do I think that it's important to make this distinction between like hard sciences that give us rules that are unbreakable and life sciences that give us tendencies? I think a couple things, and I mentioned one a little bit earlier, but when we get fixated on trying to find the one rule that will get us from point A to point B, sometimes that's a thinking trap that can keep us in analysis paralysis, or it can keep us searching for an answer that may not exist. Another reason why I think it's useful to remember that in health sciences, we get tendencies is that I've seen this happen to so many clients. They start down a change path and they do what's recommended. They do what experts say should get them a certain result. And when they don't get that result, they start to beat themselves up. What did I do wrong? What's wrong with me? I must have not done enough. And so in some cases, we may be lazy and we may not be doing enough to get a result. But I think that because we can't always predict with certainty the exact outcome that we'll get, that when we don't get where we want, it's a chance for us to practice a little bit of self-compassion and self-love instead of beating ourselves up. And again, especially when I think about weight loss, this is something that I just find people beat themselves up on all the time. Well, I ate salads for, a month and I didn't lose any weight. What am I doing wrong? And they beat themselves up, even though eating salads for a month is something that's very good for your health. Or someone says, oh, I started running and I ran 5Ks and 10Ks and I didn't lose a pound. What am I doing wrong? And they beat themselves up. Well, you didn't do anything wrong. Running 5Ks and training for 10Ks is great and it improves your health. And so, again, I think sometimes we approach our health goals either with this cling to certainty or with this idea that if we do this, it's definitely going to happen that we get to a certain result. Okay, I just want to quickly summarize and then say bye. Because health and well-being are complex, they're better understood through a holistic perspective. And no matter how much we learn, there will always be unanswered questions. If we compare life sciences like psychology, nutrition, or exercise physiology to physics, we'll find that with physics, we get more laws and rules that are unbreakable and unchanging. But in life sciences, we tend to get tendencies. And we can use those tendencies to point our action. But it's important for us to be mindful that we can't always predict with 100% certainty what an input will lead to as a reaction. Okay. As a health and wellness coach and a health professional, I think there's so much value in looking at health from a holistic perspective. And so I wrote an ebook called The 8 Dimensions of Wellness, Developing a Holistic Perspective. And I'd like to invite you to download a copy of that ebook for free on my website. All you need to do is click on the link in the description and it'll take you to my website. And there, once you join my wellness coaching community, you'll receive a link to download your ebook for free. So I hope that I said something in this video that was helpful to you. And I hope that I wrote something in my ebook that will also be helpful to you. So again, if you're interested in learning more, simply visit my website, join my community, and get a free copy of my book about the 8 dimensions of wellness. All right, I appreciate you as always for taking so much time to listen to me talk, and I look forward to connecting with you sometime in the future. Until then, be well, take care.